hip and knee replacement program is a new initiative that has been sponsored through the Toronto Central LHIN in an effort to establish a new model of care for patients with hip and knee arthritis. The objectives of establishing this new program have been to reduce wait times and to improve access for patients with hip and knee arthritis to care. The program has involved working with the 6 Toronto Central LHIN acute care hospitals, and those include the Holland Orthopedic and Arthritic Centre of Sunnybrook Health Sciences Centre, Toronto Western Hospital, which is part of the University Health Network, Mount Sinai Hospital, St. Michael's Hospital, St. Joseph's, and Toronto East General. Those 6 hospitals have worked together to establish a common referral pathway. We have a specific referral form that the family physicians or other referring physicians can use to send their patients through the process. And we have established as well specific documentation and other tools to communicate with the physicians in order that there be one process for the Toronto Central LHIN so that all patients with hip and knee arthritis can come through a central intake point and then be sent to the appropriate surgeon for management.
Well, first of all, you would need to see your family doctor. We don't have a process for self-referral at this point. So you would need to see your family doctor, and if your family doctor thought it was appropriate, they would fill out a request for consultation form. We have a form, but any referral form is fine. And there's a central point of contact, so there's a fax number that the family physician can use and send it to us directly. So the advanced practice physiotherapist is someone who's been specially trained, been mentored by the surgeons and evaluated by the surgeons. We're providing additional education on activity participation, getting back to their life and the things they want to do. And that's really part of the physiotherapist's skill set. You know, you wouldn't expect a surgeon necessarily to go into those things. But that's what a physiotherapist is trained to provide, expertise in exercise and returning to activity. And that's what we heard from patients, that they wanted more of. And that's what this is trying to do, really give patients what they asked for. Patients can expect to spend about 2 hours with us here at the center. And they'll be seen by an advanced practice physiotherapist, have a comprehensive exam. So we'll take a history, ask them questions about their condition, do a physical exam, and if we need to, we'll also take x-rays. We want to make sure that once a patient sees the surgeon, if they're a surgical candidate, they can go right on to surgery and not have any holdups or cancellations. They do. Often patients come to us and the family physician has recommended a surgeon, and if the patient has a previous relationship with a surgeon or a family member that's seen that surgeon, they're quite comfortable to stay with that surgeon. But sometimes we get asked, is there another surgeon with a shorter wait list? And that is something that we do offer. That we bring patients back 3 times in the first year and every couple of years after that, out to year 10, year 15, year 20, that's an enormous volume coming through the post-operative clinics. And if the surgeons are seeing all those patients, they have very little time to see new patients, and also those urgent patients that are coming through. So by training advanced practice physiotherapists to work alongside the surgeon, we've been able to reduce their clinic workload. And so we see all of those patients that have had routine hip or knee replacements, and we provide the follow-up care in a parallel clinic with the surgeon.
Well, there's several ways it's made things better for patients. First of all, they don't have to wait as long to get into the system to have an assessment. Traditionally, patients were referred by their family physician to an orthopedic surgeon, and many surgeons had long wait times for consultation. And sometimes people came to the surgeon with a problem that wasn't necessarily appropriate for that specific surgeon. This way, patients' information is triaged through a central intake process so that the patient is sent to the person who can help them the most. This has shortened people's wait time for consultation and certainly shortened their wait time for treatment, whether it's surgical or non-surgical. So our overall target from the Toronto Central LHIN is for the referral to surgery to be 6 months or less for 90% of people. We've done patient satisfaction surveys looking at people's reaction to this new model of care, and they've voted overwhelmingly in favor of this being a model that they love. They see more time spent with them. They get the opportunity to ask specific questions. They get some time before their surgeon consultation to think about the information they've been given. Just an overwhelmingly positive response so far.